Welcome on board. This is the Sunday show on NTH and 5, the Unity Station. This afternoon we'll be talking health. Of course, it's Pinktober. Yes, Breast Cancer Awareness Month. We'll be talking a lot this afternoon, so trust me, you're going to learn a lot. Just stay with us. My name is Uloma Ibe. Let's take this quick musical break. When we come back, I have a guest, an oncologist. He's going to take us through this journey. He will talk to us what we need to know about breast cancer and so much more. So if I were you, I'll grab a cup of juice and get ready to learn. Good afternoon, sir.
Spiritual. The Don Colocuso, the Machiavelli, number one on the calamity. Okobokeni, spiritual. Wealth. You mess. I said, I'm Mama Bonamo. Barack Obama. I said, I'm Mama Bonamo. Benedict Bieber. I said, I'm Mama Bonamo. Aliko Dangote. I said, I'm Mama Bonamo. Yes, so we go when they mighty. My guy, na Mama Bonamo. All I Tinubu, you see. My guy, na Mama Bonamo. When they mighty, if I you bow, I say na Mama Bonamo. So keep praying and focus. I say na Mama Bonamo. Ibona, Chris where you see. My guy na Mama Bonamo. Ibona. So tell me why I no go blow, why I no go make a move. So why I no go there for Papa to see the tumbo on the whole world. Oh no. Anything you want to become for life, you put them for.
Duncan Mighty for that beautiful song, Their Mama Born You. Of course, it's an inspirational song explaining and talking to us about things we need to know concerning the future, the leaders, and so much more. This is the Sunday show on NTH and 5, the Unity Station. This afternoon, we'll be talking about breast cancer awareness. What do you know about breast cancer? And I know you want to learn. I also want to learn. But before then, we'll take to the streets of Abuja, where my colleague has an article there. Let's get to hear what people have to say concerning breast cancer.
It starts with people being aware of the importance of eating right. Because a lot of people are eating junk, causing that cancer. So if we can get, into the habit of eating right, eating the right food, drinking, resting, it will reduce all that cancer risk in the society.
The best way to go about cancer is awareness, sensitization. When you are aware that there is something called cancer, then you think of what to do about it. You see, I think what we need to do is for us to start checking, because most times these things, it does not really come out to show at first. It keeps on walking around the body from one point to the other before it now becomes something that everybody will see. But when you feel, that's why they said, they always tell us in hospital that we should keep checking ourselves. You stand in front of your mirror, you touch your breast, you feel it, because it's not about somebody being sick these days. It's not because you are eating too much of this or too much of that. It just happens. So what do? You just keep checking yourself. Look, if you notice anything, like maybe you feel any lump under your armpits or anywhere, any part of your, go and see your doctor so they can check and know if there's anything. If you need to go for a further checkup, you will know. You should not just keep quiet. For me, I think it's about awareness, checking yourself, and then if there's anything, you let the doctors know what you are feeling.
One of the ways to reduce is to reduce the intake of canned food, because canned food has a lot of preservatives that's not good for the body. Another way to do so is women should check themselves at an early age. We must teach our children how to check themselves. When they become teenagers, when they begin to bloom, they must check so that we catch it at an early stage.
Thank you so much. And we are back here. Let me quickly introduce my guest. His name is Dr. Adamu Kaburi. He is a clinical and radiation oncologist, and we are glad to have him to take us through this conversation. Welcome, sir.
Thank you, ma'am.
Good to have you.
Good to be here, ma'am.
Yes, we know through the years we have different months. Different months are talking about different awareness. But this October, October, talking about breast cancer awareness month, and we want to know everything. Within the short time we have, what is breast cancer?
So, breast cancer is uncontrolled cell growth in the breast, and there are different types of breast cancer. This is according to what we call immunohistochemistry. But before then, we usually do what we call histology. So histologically, they are classified into invasive ductal carcinoma and invasive lobular carcinoma. So for the immunohistochemistry, there are three subtypes of breast cancer. We have the hormone-sensitive types. We have the triple negative, which is very, very aggressive. Most of these patients, when they present to us, they already come at stage 4, which is metastatic. And we have what we call HER2 overexpressing type of breast cancer. It is aggressive, but not as aggressive as triple negative. And there are new treatments for that. We have the targeted therapy that is used for treatment of HER2 overexpressing breast cancer. Well, for the risk factors of breast cancer, generally, cancer, the cause of cancer is unknown globally. Unknown is unknown, but there has been risk factors that have been tailored down to be associated to breast cancer. Okay. Some of those risk factors are family history. There are some genes that are implicated in causing breast cancer. We have the BRCA1 and BRCA2 mutated genes. You know the story of Angelina Jolie, where she had to remove her breast, her ovaries, because her mom, her aunt, and her grandmom, all of them had cancer, and they had a very strong BRCA gene in the family. Other risk factors that may be associated with breast cancer, we have the long exposure to estrogen. We have the endogenous, and then we have exogenous. For the endogenous, we have when a woman sees her menses very early, that's what we call early menarche. Also late menopause. We can have where a patient, where a woman gives birth after the age of 30 years. Yes. Pregnancy is protective for breast cancer. So if a woman doesn't give birth, that's if she's nulliparous, there is an increased risk of her having breast cancer. There are other lifestyle that may be associated with breast cancer. We're talking about alcohol, smoking, obesity is one very key thing that is associated with breast cancer, because the cancer cells feed on fat cells and all that. So other causes of breast cancer, or rather risk factors that can be associated with breast cancer, you have age after 30 to 40 years and above. Also, being a woman is a risk factor for breast cancer. So yes, so I mean, even men have breast cancer, but that's like about 1% of men having this breast cancer. But 99% of women, according to statistics, have breast cancer, as opposed to 1% for the men.
You explained a lot, a detailed answer there. I like that. So, what should a woman look out for in her body? The signs and symptoms. What will you see that will take you straight to the hospital? Is there anything that we want to know, want you to explain to us?
Yes. So there are key things or key signs and symptoms that a woman, would experience and would give her that alarming opportunity to, to go to the hospital. One of those things is breast lump. Yes, appearance of a new breast lump. Usually it's painless. It's not painful. It's painless. Nipple discharge, either bloody nipple discharge or even clear nipple discharge, is one of the alarming signs you may need to see your physician for or doctor. One other thing again is swelling in the armpit. Like we call it
swelling in the armpit.
Swelling in the armpit, yes. One sign and symptom of breast cancer. Also, pain in the breast. When you suddenly start feeling pain in your breast, you should get that breast checked. Another thing, very rare type of breast cancer, is it doesn't come with lump, it doesn't come with anything. It comes with itching around the nipple area. It's called Paget's disease of the breast. It's a rare type of breast cancer. Where a woman starts to itch the nipple and it turns into ulcer. It looks like an eczema kind of rash. Some people don't pay attention to it. They think it's maybe just a rash, and it may even delay them to go to the hospital and all that. So women should actually look out for this, because in my practice I've seen just only one case, and even that one case is very significant. So women really need to look out for that sign, that itching around the nipple area. It's called Paget's disease of the breast.
A lot now. How do we check? How can women check? You talked about breast lump. How will you identify this breast lump?
Yeah, like I said, it's usually painless.
Painless.
Yes. So you can do what we call breast self-examination, where a woman before her menses, she can check herself in the mirror, examine herself, and check for lumps or any abnormal thing around both of her breasts. So if she gets a mirror, check herself and all that.
So this check should be monthly? Yes,
monthly. Monthly. It should be monthly. And you can also do a breast ultrasound scan. A scan of the breast, just to check, because there are some times where even yourself, it doesn't show. It's called sub-centimeter. It's so small, minute, that a woman may not be able to feel, or the woman may not be able to pick, but ultrasound scan can pick it, and from there we can do further evaluation and other tests.
It's the Sunday show. Welcome on board if you're just joining. This is Breast Cancer Conversation and Awareness Pinktober. We'll take a quick breather. When we return, it will be time for the phone lines to be open. So you ask your questions, you have concerns, you want to talk to the doctor about directly, you will have that privilege. Let's take the break.
There's been a lot of faking, so many hearts to break me. The last time you check, I'm undefeated. See them start to drag about my rating. Let me make you dance, cause I'm with it. I've gone through the fire meant to break me, but we all look out for the safety. Gratitude is what I'm feeling. Nobody will give me love, I go give my money. Say na shawty way go start you, spread the moolah for her body. Wow, shawty way give me love, I go give my money. Say na Kelly way go start you, spread the moolah for her body. Sometimes me I realize I need a woman for my life. Only my time make you come alive. I go always stay online. Look with that bad and in my side. You say me I know the lie. If you try, if you shut down, you Kọ́lẹ̀ tó ń wo the light. Wọ́n lé wọ́n fẹ́ lé mi bá o. Ọlọ́run gbọ́ wọn lè rí mi o. Mo kára tán.
Thank you very much for that song. We head straight back to the doctor. So, doctor, what's next? When the person has finally found out that yes, there's a breast cancer, what's the next thing to do?
So we as oncologists, when a patient says they have breast cancer, it means that that patient has done a breast biopsy, and the pathology confirms that yes, that's breast cancer.
So the person must have done it.
Must have done breast biopsy, and the pathology has confirmed that that is breast cancer. The patient comes in with the report stating that it is breast cancer.
Not just seeing a lump.
Not just seeing a lump. Yes. Okay. So the first thing is to do a breast biopsy, and then pathologist confirms that it is breast cancer. Okay. They come to us, with the histology report, and then what we do is to explain to them that, oh, madam, this is breast cancer, and the next thing to do is to stage this patient. To stage this patient appropriately, there are imaging modalities that have been put in place. But the best imaging modality to diagnose or to stage this patient is using a PET CT scan, but it's not readily available in the country. Just only one in Lagos. So what we usually do is to use a CT scan just to stage them. So we have stage 1, stage 2, stage 3, stage 4 of breast cancer, and each of them have different approach to treatment.
Okay, the line is now open for you to call, and you meet the oncologist here, our doctor, to explain to you if you have questions, you have concerns, you have contributions as well. The doctor is here to hear you. So the phone lines are boldly on your screen. Please get them and reach out to us. Thank you. So you stage them.
Yes.
After confirming that there's actually breast cancer.
There's breast cancer. So you stage them. Breast cancer has 4 stages.
Which is the worst, the most serious?
The worst stage is the last stage. That is stage 4. It is metastatic. It means that the cancer has left where it started from, that the breast, to any other parts of the body. Usually, breast cancer spreads to the lungs, bones, liver, and in rare cases, very severe cases, spreads to the brain. So.
Okay, what treatment is available for these people? Let's say the person has come up with your confirmed result, yes. Stage 1, stage 2. What treatment is available for all these stages?
Yes, so we do what we call immunohistochemistry, because breast cancer is subdivided again into 4 types according to immunohistochemistry. We have luminal A, luminal B, we have triple.
Hello, good afternoon. Please help us move away from your TV set. Thank you very much. Good afternoon. Okay, sorry. You try to call us back, but move away from your TV.
Yes. So we have also triple negative and HER2 overexpressing breast cancer. All of them have different approach to treatment. So, for you to be able to treat them, you need to do what we call IHC. It's called immunohistochemistry. Yes. So.
Hello. Okay, I can hear you. We'll continue.
Okay, so there are different treatments, from surgery to chemotherapy, from chemotherapy if the patient requires radiotherapy, and we have hormonal therapy. We also have targeted therapy, which is a new type of treatment modality for HER2 overexpressing. And then in advanced cases, you can use immunotherapy for treatment. So you can see there are about 6 modalities of treatment for breast cancer.
Now, I'll ask this big question. What is the survival rate?
Well, the survival rates for an early stage, which is stage 1, stage 2, survival rate is around 90 to 99%.
For 90 to 99%?
Yes, 90. Yes, for early stage, once you catch very early.
And you define the early stage as stage 1?
Stage 1, stage 2. Okay. Yes, early stage. But for locally advanced, which is stage 3, there's lymph nodal involvement, that move to the lymph node. The survival rate for those set of patients is 70 to 80%.
Hello, good afternoon. Hello. Good afternoon. Yes, welcome on board. Hold on, your network issues. We apologize. Try and call back. The phone numbers are on your screen. Okay, doctor, let's continue.
Yes, so like I was saying, the survival rate for a locally advanced, which is stage 3 breast cancer, is 70 to 80% survival rate. And then for stage 4, that is if the breast cancer has spread to other organs, survival rate is 30% for that. So you can see survival rate for stage 4 is actually very low, and that is the reason why we advise women now to do frequent, breast self-examination, and also even do attend outreach programs where they do breast screening, by using ultrasound scan, and even there's a new method called thermolytics where they used to diagnose these women.
Let's talk about men now having breast cancer. You said it's 1%. How can they also check? Is it the same way?
Yes, same way. You can also do a breast ultrasound scan.
You said after a woman's menstrual cycle.
Yes.
What about a man? What time is the breast?
He can do it monthly to check his breast, yes, of any abnormality, any lump, any pain. We can further evaluate that man by doing a breast ultrasound scan, and if need be, we'll do a biopsy, and if required, we can do what we call tumor marker. It's called CA 15-3 to check for circulating breast cancer cells in the blood.
So after this treatment, the chemotherapy and the rest of them, does it reoccur? Let's say the woman has breast cancer, one of the breasts, the tendency of it to reoccurring at the second one. What's the
Yes, according to statistics, there is some percentage that if a patient has breast cancer already, there's some percentage that yes, a patient has that high risk of having, to develop breast cancer in the other breast or any other even type of cancer.
So what would you recommend if you've seen that the patient has the breast cancer on one of the breasts? Would you recommend the treatment for the two, or what's the professional way?
Well, it first depends on choice of the patient. If the patient wants, to have both breasts removed, fine. But for us, we start to treat the breast that has the breast cancer.
Right.
Yes, but some people will come and tell you that, oh, doctor, I want to remove the two breasts, which is actually protective, just like what Angelina Jolie did.
Did you have people willingly to do that? When you tell them, yes, this is the only method available for you, this is the best treatment for you to take off the breast?
Yes, it's actually quite challenging for women that have not given birth to children. Women that are not yet married. Having to remove your breast is very challenging, but we still make them understand that your life first. Especially if it's metastatic, because young women mostly have triple negative type. I remember telling you that it's the most aggressive type of breast cancer. So it's very challenging, telling these young ladies to remove their breast when they don't even have a husband or they don't have children. Yeah, so it's very, very challenging. But we'll still try as much as possible to let them know that their life first, save your life first, before thinking of.
You made mention of some risk factors. I'd like you to talk more on that. Then talk to us. Are they lifestyle modalities, modification? Are they things we need to do or prevent that would help?
Yes. So like I said, obesity is one heavy risk factor for breast cancer. So we encourage people to do frequent exercise, to eat very balanced diet, high fiber diet that is kind of preventive for breast cancer. So frequent exercise, if possible, for them to cut down or to even stop alcohol totally, alcohol and smoking, then to stop alcohol and smoking, because alcohol and smoking has been linked to a lot of cancers.
Let me take this call.
Yes.
Hello. Hello. Yeah. Continue.
Yes. So, like I said, alcohol and smoking have been linked to not only breast cancer, to a lot of cancer. So, if they can be able to do away with alcohol and smoking, it will go a long way in prevention of not just breast cancer, but other cancers.
As I try to wrap up, what would be your parting shot for all the women, including the men?
1%, yes. So, my take-home message is that breast cancer.
Sorry, sir. We need to take this call because of the network hiccup. Hello, good afternoon. We hope this comes through. Good afternoon, ma'am. Yes, welcome on board.
Thank you.
We have to be fast. Our time is almost ending.
Yes, ma'am. My mother has been diagnosed village there, they took her to the hospital and they started chemo for her. But I don't know if there is any, I doubt if the doctor taking care of her is not an oncologist, but they started the treatment on their own in the village. And I don't know if she has taken a one round of chemo. And we are waiting for the second round. I don't know how to is for an ordinary doctor to, the general doctor to take care of the
Cancer patient. Okay, thank you very much. The doctor will react just quickly.
Okay. So for treatment of breast cancer is multi-modality, multidisciplinary. So not just only the surgeons treat breast cancer, even the oncologists treat breast cancer. So my advice for her is because I heard her mention that who is yes, stage 3, and then the person that is evaluating and treating the mom, even though she has had chemotherapy, is not an oncologist, which I think is not right. So I think they are, like I said, it's multi-specially, multi-disciplinary. So surgeons, pathologists, oncologists to be involved. I advise her that they should take the mom to also see an oncologist who, would check and then give appropriate treatment if she needs surgery. Fine.
Thank you. Please, your parting shots in 10 seconds.
Okay, yes. So my take-home message for viewers out there is that breast cancer is not a death sentence. There are many patients that have been diagnosed with breast cancer are still alive today and have even passed the 5-year survival rate. So women, men should also engage themselves in, do frequent screening, at outreach programs, and also they should involve themselves in doing some testing, and this testing includes doing ultrasound scan if possible, and also they should engage themselves in doing more exercise and keep away from all this lifestyle that may be a risk factor for breast cancer. Thank you so much.
Thank you so much, Dr. Adambo, for coming. We really appreciate you. Despite today's Sunday, we know you're very busy, but you're here with us. Thank you so much.
Thank you
for all the explanations. Thank you very much. I'm sure you've learned something concerning breast cancer today. Keep living the proper lifestyle and it will get better. I'm Uloma Ibe. Good afternoon. Have a super Sunday.